this lesson, we're going to be talking about the significance of a newborn with a HIV positive mother and your role for this care. All right, so you have a patient that's pregnant and she has HIV. Our care will revolve around protecting the newborn as best that we can. To do this, you need to understand how it's transmitted. So there are a few things. It could cross the placenta. So it could move across the placenta during pregnancy. It could also transmit during childbirth, or also through breast milk. So those are our big ways for transmission, our placenta, birth, and breast milk. So if it crosses the placenta, we can't really prevent much about that. But we can do is have this patient deliver by a C-section, and that will limit the risk of transmission. So C-section is going to be how we should deliver this patient. This is going to limit that exposure. We also want to help limit the exposure risk by encouraging bottle feeding, because breastfeeding can continue to expose the newborn. So for this one, we will encourage formula bottle feeding. I was once caring for a newborn whose mother was HIV positive. I went to her room prior to delivery just to let her know everything that will be done after delivery so she could be, part of the care and understand what was going to be happening. The real reason why I wanted to prep her was because I was told that the father of the baby was unaware that she was HIV positive. It was a very crazy situation because the patient was also a lawyer. I know, right? So many things there, just the whole legal piece to this. So the labor nurse went in and she said she had told the father everything and we were good. So the father supposedly knew. I was thinking, great, no more secrets, we are good. Well, then I walked back to the OR for delivery with the C-section, and the doctor was scrubbing in and the dad was sitting with his head against the wall. I just knew something had gone down, something was not right. Come to find out, the doctor had asked him if he had had any questions about the HIV. Questions about it. And the dad just responded, she told me about it and that all babies receive prophylactic medication and treatment. I think as he was saying it, he probably realized how crazy that sounded. And the doctor told him, no, she has HIV and you need to be tested immediately. And then in walks me thinking everything was good. So I would fully expect anyone to storm out in this situation and not stay for the delivery. But he stayed for the delivery. He took pictures. He acted as everything was fine. He left after the delivery and hopefully got tested. It was awful. Just felt so bad for him and also for the mom. She explained she got HIV at birth because of her mom had a drug problem. And she didn't want to ever tell him because he wouldn't love her anymore. I wish I knew the ending of this story. Sometimes things like this happen and you just always wonder what happened. But he did end up coming back and helping care for that baby. And hopefully he didn't have it and everything went smoothly. But just one of those strange cases as a nurse that you see. All right, so now let's look at our assessment and management for this patient. When you have a baby born that is HIV positive or HIV positive mother, you really won't notice anything different. They are going to be asymptomatic usually of anything at this time. They are going to have lab work done as part of their assessment. Most of this is sent out, so you're not going to have those results back while the patient's in the hospital, and it's just used for follow-up. But they'll get a CD4 count and just be tested for HIV. These patients have a long follow-up because they have the mother's antibodies. So if you look immediately, they could be show as that they're positive for HIV, but really they have the mom's antibodies. And it can take about 18 months to actually get a true story, like true, do they actually have it or do they not? So just a lot of follow-up. These patients are going to need to be given Cidovudine or AZT, just those antiretrovirals. So they'll be given those in the hospital, and usually those will continue for 4 to 6 weeks, sometimes even longer after delivery. And a bath. So, we're all about prolonging a bath. In these cases, these babies need a bath immediately once they're stable because we need to clean off any of the maternal fluids to clean that baby so that we limit exposure to that infant. And we, of course, want to be doing this before we're getting any lab work or starting any IVs, any pokes and punctures, because we don't want any of the maternal fluid to get into the baby's system. Our education is going to include the recommendation with breastfeeding, so that breastfeeding should not be done. We would rather them do formula, so we can explain why. We're just going to prevent passing any more fluids and exposing that baby. Medications and vaccines. So we cannot, or they cannot ever receive a live vaccine until they are cleared and do not have HIV, which remember, that's like at 18 months. So we will not give them any live vaccines, and that they should know that their baby will not receive any or should not receive any. And then medication. So if they're getting that AZT, that they're going to be getting that for 4 to 6 weeks or even longer. So they'll be educated on giving the baby that medicine for discharge. And then follow-up. They need to know when they should be following up. They're going to have frequent follow-up appointments and a lot of testing to confirm a diagnosis. So we want to show them how important it is for their baby to be taken to these follow-up appointments. Our concepts for this are going to be immunity, because we are worried about the immune system of the newborn, infection control, because we're trying to prevent that exposure and spread of HIV, and lab values, because this newborn is going to receive a lot of frequent lab tests and monitoring. All right, so the key points. If you remember these main points, you are going to have a great understanding for the care of this patient. So the baby must be delivered by C-section to limit exposure. We want to give an immediate bath when they're stable to help clean off any of the maternal fluids, as well as give the baby the zidovudine just prophylactically to help with getting rid of the HIV, or to prophylactically just start treating the baby. And then no breastfeeding. So we want to formula feed this baby. Make sure you check out the resources attached to this lesson and the immediate care that this newborn will receive. Now go out and be your best selves today. And as always, happy nursing.